6:21 and new this morning after use of the COVID-19 vaccine from Johnson & Johnson was halted all across the state. Could health providers face even more challenges getting those in rural areas vaccinated?
It's a big question. Matthew Hurch getting us answers, joins us in the studio. So how much of a wrench is this putting in on their plans?
Well, Matt and Monica, I spoke with Adina Health System, who has only been using the Johnson & Johnson vaccine for those 18 and up. And while this could have serious ramifications on providers everywhere, at Adina, they say they hope the transition to one of the other vaccines will be seamless. Now, Adina operates one of the state's 16 mass vaccination clinics in Chillicothe, and one healthcare system spokesperson told me that they had been seeing greater demand in their area for Johnson & Johnson because it requires just the one shot. So what does this mean for them moving forward with their clinic? Well, in a statement, Adina Health says that they will continue their mass vaccination clinic appointments today through Friday using the Moderna vaccine and scheduling those people for their second doses. And anyone scheduled at their clinic this week will receive a call from ODH about the switch with their option to keep the appointment. Now, Adina says that they have enough Moderna on hand to get them through this week, and with another shipment expected next week. But the latest with the Johnson & Johnson only complicates efforts in rural parts of the state where getting shots in the arms has already been difficult. Adina's director of quality says that logistics with the two earlier vaccines were a challenge as it relates to storage in these smaller areas. He also says internet and broadband concerns created struggles registering for appointments, but they've been doing all they can to make that process easy, including providing free transportation.
We're the only mass vac site that has transportation set up for those 14 counties to get transportation to our vaccine clinics. So we were trying to help some of that underserved population actually be able to set up a transportation appointment that's free to our mass vac site with some of the local county transportation departments.
Now, the larger geographical landscape of rural areas has created obstacles, but vaccine hesitancy may also be playing a role. Matt, Monica, this is the Ohio COVID-19 vaccine dashboard, and you can see the darker blue areas are where vaccines have been administered more. You see Cleveland, Columbus, Cincinnati areas, but if you look, for example, here in the central Ohio area and look at Franklin County, you can see about 35% of the population has been vaccinated. If it pulls up here. There we go. About 35% have been vaccinated. If you look a little bit further to the north, Delaware County, 46%. But if you start to look at some of the more rural areas, if you look up, for example, in Morrow County, just to the north of Delaware, you're seeing about 26%. If you move all the way over, for example, in Holmes County, you'll see just about 12% have been populated. So when you get to those rural areas, the vaccine isn't quite as widespread, and those numbers are going to be really important to get to that point of herd immunity that we talked about just a couple days ago.
12% compared to 46% is pretty vast.
That's a big difference.
Yep. All right, thank you, Matthew, breaking that down.
Well, it is 6:24 this morning. Time for us